DermBiz episode 10. In this episode, we're going to talk about MCOs, managed care organizations. We're going to discuss how they profit, how they actually make money. We're going to also talk about how they're not as efficient as they claim to be. The level of care that you can provide your patients and the expectation of reasonable compensation for those services you provide are impacted every day by MCOs. You're not going to want to miss this episode. DermBiz episode 10. Let's get started. In this episode, we're going to talk about what I believe is one of the biggest challengers, one of the biggest obstacles, one of the biggest bullies that stands in the way of doctors being able to provide high quality care for their patients and patients being able to receive that high quality care. This organization I'm talking about profits on denying medications, profits on denying services that patients need, and profits on overcharging state and government run organizations. The kind of organizations that we're talking about are called MCOs. Welcome to DermBiz, where we create content and build community with the purpose of supporting private practice medical clinics. We're going to hop right into it because you may be wondering, okay, Tony, what exactly is an MCO? Well, an MCO stands for a managed care organization. And so MCOs are private companies that states contract with to manage and deliver healthcare. And MCOs are huge. Currently, 72% of Medicaid patients, their plan is overseen by an MCO. That's pretty much the majority of people on Medicare are being overseen by an MCO. In fact, the five biggest MCOs, Aetna, Elevance, Molina, United Healthcare, CVS, they're all on the Fortune 500. Okay, so you may be thinking, I get it. I know what an MCO is. But what does this have to do with my private practice? What does it have to do with the care that I can provide my patients? What does it have to do with the reasonable profits that I can receive for providing that care? So let's break down how MCOs get paid. They get paid a set amount per person. It's a fixed rate. Therefore, their profits come from anything that's left over. So anytime that they can administer care and there's dollars left over after that care was administered, that's their profit. They actually are compensated for finding a way to pay less in healthcare costs for patients. You know, in state after state, there have been cases of MCOs denying care, not because it wasn't warranted, not because it wasn't needed, not because it wouldn't help the patient, but denying care as a profit strategy. They deny care to make more money. In fact, the state of Iowa transitioned to using MCOs to manage their Medicaid program in 2016. And just in the first 3 years of Iowa working with this MCO, there was a 900% increase in fraudulently denied claims, illegally denied claims, claims that should have been approved, care that should have been approved, medications that should have been approved that were denied as a profit strategy by that MCO. To sum this all up, the profit that MCOs earn are based upon the claims that they can deny. They are incentivized to deny claims. And how do they do this? They deny an attempt to receive one particular medication and force the doctor to prescribe a cheaper medication, one that may not necessarily work as well, but it works for the MCO financially. What else do? They deny services. And you will say, well, how could they deny a service? Because you're in the exam room providing a service for the patient. Well, they deny it after the fact, meaning oftentimes doctors do work. They put their time and energy in. And after the MCO sees the care, they see the office notes, they say, you shouldn't have did X and you shouldn't have did Y. And because of that, we're not paying for that. So you've basically done this work that you now cannot collect on. And many times, not only can you not collect on it, you can't bill the patient because the MCO says that it was an unnecessary treatment or procedure. And so the quality of the profits that MCOs receive is based upon how well they deny care to the patients that they were signed up to serve. Many may argue, wait a minute, Tony, the purpose of MCOs, the purpose of Medicare Advantage plans, the purpose of these private companies that are contracting and working with governmental agencies is to curtail the overspending. Isn't healthcare bloated? Aren't doctors overcharging and performing services that don't need to be done? Won't these organizations curtail some of that spending, reduce the cost, and actually make healthcare affordable? If they did, they would have a very, very strong argument. However, that just does not mesh with the statistics. So, according to MedPAC, an official website of the United States government, Medicare actually pays 6% more to MCOs than they would actually spend if they were just paying traditional Medicare. In fact, MCOs will cost an additional $27 billion that would have otherwise not had to be paid out if they were just dealing with traditional Medicare plans. And once I heard that information, a light bulb came on and it made me realize, oh, okay, I see the game that they're playing. Medicare Advantage plans oftentimes are cheaper than, usually always, are cheaper than a traditional Medicare plan. So they can sign up massive amounts of people with the Medicare Advantage plan, or they have a captive audience of people who are on Medicaid who have to take the plan, who have to submit to their organization. They get all of these people. They collect the monies coming in from the government. They then deny coverage, deny services, deny medications, overcharge, and that's how they can end up on the Fortune 500 list. Now, I know it's not that simple. Many of these companies that are on the Fortune 500 list, they've done other things. They're comprehensive in their healthcare providing, and so they make money in a lot of different ways. But this is a huge profit center for these companies because they're getting guaranteed money from either the government or always guaranteed money from the government, and they're using that money to shortchange the patients that they're supposed to be helping, and also shortchanging the medical providers who provide the service to help the patients. In fact, a 2013 audit showed that 8 of the 10 largest MCO plans submitted inflated bills to Medicare. They're essentially fraudulently billing Medicare, overbilling Medicare. In that same article, Dr. Kenneth Williams, who was the CEO of Alliance Healthcare, said they don't want to pay for anything. Deny, deny, deny. That's their strategy. That's how they earn profit. So I just want to caution all private practices out there. Beware of MCOs. They don't have your patient's best interest at heart, nor do they have your reasonable compensation at heart either. Thank you for watching. If you enjoyed this episode, please don't forget to like and subscribe. We'll continue to make this content as long as we know you guys like it and it's helpful to you as you run and manage your private practice.
What other specific topics related to the business of private practice management would you like for us to cover? Please share in the comments below or reach out to us on social media or our email address, thedermbiz@gmail.com. Our mission is to create a movement of collaboration and support amongst physician-owned private practice owners. If you would like to join that movement, again, don't forget to like, share, comment, and please don't forget to subscribe.